Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about gastric cancer. We are going to see what is gastric cancer is, what are the stages of gastric cancer, what are the symptoms of it, what are the causes, and what are the diagnostic tests available, and what are the treatment options available, and precautions. So let's get started. What is gastric cancer? In gastric cancer, cancer cells usually begin in the inner lining of your stomach. They grow deeper into stomach walls as the cancer develops. Now let us see the stages of this cancer. Staging is a way of describing where the cancer is located, where it has spread, and whether it is affecting other parts of the body or not. TNM, that is tumor node metastasis staging, is the most common way the doctors stage stomach cancer. So there are total of 5 stages. This includes high-grade dysplasia, that is stage 0, and stage 1 to stage 4. Now let us see the symptoms of this condition. Stomach cancer doesn't typically cause symptoms during the early stages. As it grows, it shows the symptoms such as loss of appetite, trouble swallowing, fatigue or weakness, nausea, vomiting, unexplained weight loss, heartburn, and indigestion. Black or bloody stool or vomiting of blood, feeling bloated after eating, stomach pain often above your belly button, feeling full even after eating a small meal or a snack. Now let us see the causes of this condition. Stomach cancer forms when there is a genetic mutation, that is change in the DNA of your stomach cells. The causes include family history of stomach cancer, H. pylori infection, GERD, gastritis, Epstein-Barr virus infection, history of stomach ulcers and stomach polyps, a diet high in fatty, salty, smoked or pickled foods, a diet that doesn't include many fruits and vegetables, frequent exposure to substances like coal, metal and rubber, smoking, vaping and chewing tobacco, drinking too much of alcohol, obesity, autoimmune atrophic gastritis. Now let us see what are the diagnostic tests available for this condition to diagnose. Upper endoscopy with biopsy, endoscopic ultrasound, radiological tests include a CT scan, barium swallow and MRI can help identify these tumors. Laparoscopy. Now let us see the treatment options. Gastrectomy, chemotherapy, radiation, immunotherapy, and palliative care. Prevention. How to prevent this condition? Treat H. pylori infection if you test positive. Treat ulcers, gastritis, and other stomach conditions promptly. Eating a healthy diet that's high in fruits and vegetables and low in salts and red meats can reduce your stomach cancer risk. Avoid smoking and using tobacco products. Maintain a healthy weight. Please like, share, and subscribe to Expert Medical Coding. Thanks for watching.